Broadcasting from the studios of Business RadioX, it's time for the Good2Give Podcast. This show is underwritten by the Community Foundation for Northeast Georgia, connecting people who care with causes that matter. Now, here is your host.
Hello, everyone. This is Maria Walden with the Community Foundation for Northeast Georgia. I'm sitting here with my co-host, DePriest Waddy.
Hi, everybody.
Yeah, we're excited about being here again today, and we've got an amazing guest with us today, and she's a little special, and we're going to go into that a little bit later. But we've got Shameka Allen, who is the CEO of Good Samaritan Health, and you're located in Gwinnett, right?
Yes.
Is that right?
We are.
How many locations are there?
So there are 2 locations. Both of those are in Norcross.
Wow. Okay, so we're going to jump into what you do. But DePriest, you've got a long history with Shameka and understanding that organization.
I do. The previous executive director, Greg Lang, and I go way back, and I was just really thrilled when, for 2 things, and this is something that was very fortuitous and very forward-thinking of Greg to say, hey, in 2021, he said, I know I'm not going to be around here. I want to enjoy life and retire at some point, and I want to bring in my successor so that we can steadily kind of work side by side and have a smooth transition. I really applaud that approach because a lot of leaders really don't put a timeline on their longevity. And so Greg was fortunate enough to find Shameka and hire her, and they have just been a great partnership, and now he's the CFO and she's the CEO, and I think that they've got great things on the horizon. So we're going to jump into that. But first question I have for you, Shameka, how there are a lot of Good Sams around the city. So
Yes.
What are they all separately, and how does that name? Is there some type of a franchise, or how does that work?
Yeah, so that's a good question. We get asked that a lot. So the original Good Samaritan Health Centers was started by Dr. Bill Warren in downtown Atlanta. Dr. Warren is a pediatrician, and he had been working very hard in that neighborhood and established that health center to help those who were low income, uninsured, in need of health care, and had a very good model in place. So in 2005, actually in 2003, some folks from Perimeter Church asked Dr. Warren, hey, could you help us establish something very similar here in Gwinnett? We want to do what you're doing for low income, uninsured, those who don't have access to health care. And Good Sam Gwinnett was modeled off of Good Sam down in Atlanta. We are a totally separate entity from Good Sam Atlanta. We like to say we're friends, but not relatives. We go down, I think we went down there last year. We know their current CEO, Brianna Lathrop, just recently got promoted. Dr. Warren stepped down officially as CEO, so she just recently took over. But
Wow.
So we're not affiliated, but we definitely appreciate the insight from Dr. Warren because that's where the concept came from.
That is
Wonderful.
amazing.
Yep.
That's a great place to start.
That's a great question too, DePriest, because I saw that when I was Googling Good Sam this morning even, I was thinking that everything was coming up. So that's good to know.
Mhm.
Yes.
So how would you designate, if someone were to Google you, how would they find you?
I would just look for Good Sam Gwinnett.
Gwinnett.
Yeah, Good Sam
Okay.
Gwinnett. I'll make sure it has Gwinnett after it.
Okay.
Because there's also a Good Sam Cobb and there's a Good Sam up in Jasper. And of course, if you don't put anything after Good Samaritan, you're probably going to get the Atlanta location. So I would just say Good Sam Gwinnett, you're 99% of the time going to get directed to us.
So you're in Gwinnett. Do you only serve people in Gwinnett?
We do not. We serve anyone in the metro area. We have folks come from as far away as North Georgia, all the way down to South Georgia. We have residents from DeKalb. A lot of folks come to what we call our East Clinic that's off of Jimmy Carter and Rockbridge out of DeKalb County and out of Fulton County. Recently, we had someone come as far as Douglas County. So you don't have to be a Gwinnett resident to use our services.
Amazing. So let's jump into what you do.
Okay.
I think. Is there anything, DePriest?
I'd just be curious to level set on the demographics. What is the typical family that would come through the door of a Good Sam, and what type of, I know Gwinnett is one of the most diverse counties in the world
Absolutely.
or in the nation. So let's talk about that just a little bit to give a context to our audience around the diversity that you serve and what poverty looks like.
Absolutely. So if you were to look at it from a purely demographic level, our average patient is a 46-year-old woman. typically a Hispanic woman, on average 2 to 3 children, with a median income between $40,000 to $50,000 per year. And that's certainly if you look overall. But with Gwinnett being Gwinnett, just by virtue of where we are located in Norcross, we serve a heavily Spanish-speaking demographic. But lately, I would say probably even over the last year, we've seen that really expand. Recently, we've had a lot of folks from Southeast Asia, a lot of folks from India, a lot of people from West and East Africa. Because we do get referrals from the health department, we get health referrals from the school system. So a lot of times if folks are newly arrived to Gwinnett or even to the U.S., and they don't have health care, we specialize in being able to start from scratch, right? So if a person has been receiving health care in their country of origin and we know nothing, that's what we do, right? We don't say, oh my God, we don't know what the patient's history is. We don't know anything. Our providers see that every day. But yeah, it's a wide range of countries and cultures. I think last count, our patients represented over 80 countries.
Wow.
So if you
That's
ever
amazing.
come to our office and see our map that we have at our main location, we ask people to put pins in their country of origin. And so far we have 80 pins.
Is the language a barrier?
Actually, Spanish, all of my support staff speak Spanish. So we're very fortunate that we hire folks who speak the most common language, but we have recently invested in a language line.
Oh, no.
When we started getting folks in from, I remember like yesterday, we had a patient come in from Somalia. And no one could understand her. She even brought an escort with her, or someone came with her chaperone, and the chaperone could not speak Arabic either. So that day I said, we're getting a language line. And so now we have access to over 200 languages, and we've had to use it many times.
That's amazing.
That is amazing. Wow. That's just incredible. 80 countries.
Yes.
And that you serve, like you said, the average is about a 40-year-old woman, but you not only see women.
We see everybody. We like to say from the cradle to the grave, right? So all of my practitioners are family practice nurse practitioners, so they can see children. Typically, we say as young as 6 months, even younger, all the way up to geriatric patients.
Okay. So the cost to someone, I know what the answer is, but tell us about how one would pay.
Yeah, so we like to emphasize this because we don't operate like a typical charitable clinic where we come in and get free services. We do believe that patients are more vested in their health care if they pay a portion. So we like to say we have a discounted health model. So if you are a new patient, you can be seen for roughly $110, and that's the cost of everything, right? You'll get your full exam, and then if you have labs, there's a little bit of a cost associated with that. But then what you'll notice is that your payments will decrease over time. You'll go to your second appointment might be $60 because it's just a follow-up. And if it's a really simple appointment and you've been doing everything you're supposed to do, it may go down to $40. But we still believe in God's grace. If we do have a patient that comes in and says, look, I have nothing. I'm in pain. I need to be seen. And this is on the medical side. Dental is we will try to assist that patient with what we call our Good Sam funds. And those are funds that we utilize to help those who may be in a situation where even that dollar amount they can't afford.
So you mentioned that it starts at one level and then it decreases. Is that somewhat like a deductible?
No, it's actually what we call an incentive to care.
Okay.
Right? So like it's not a deductible. Everyone who comes in Good Sam is self-pay. So we cater exclusively to uninsured patients, right? We don't take any third party. Even Medicare and Medicaid, we don't accept. It is the same dollar amount regardless of what you make. So if your income is lower, it's the same dollar amount. And conversely, if you are making more money, your rates don't go up. So we don't believe in penalizing people for getting a leg up on poverty, right?
Yeah.
And so you'll pay that dollar amount, but it goes down because we want to incentivize you to do what your provider asks. Because theoretically, your visit should become less complex if you're following up, eating, coming to your appointments, doing those things, because we can get you in and out quicker.
That's an interesting model,
Yeah.
especially because I would assume that most of your clients are either uninsured or underinsured.
Yes. So everyone who comes in there is at least uninsured. And lately, with insurance becoming very complicated, we have even had people who say, hey, listen, I've got insurance, but I've got a $10,000 deductible.
Wow.
Which means you're not going to get a primary care. You really don't have, it's more like a catastrophic plan. We've had to look at our policies and say, okay, what if they don't have primary care insurance? Are we going to turn those folks away? Because technically, if they have a chronic illness like diabetes or hypertension, they're never going to have coverage. And if you look at the fair market value of those visits, typically in a doctor's office, they're going to be a couple $100, or you're going to have to go to maybe a pharmaceutical chain and go, but you never get the same provider. You're going to have somebody different that you have to explain your case to every time you go. It really does incentivize folks to come to us because we can put them on a continuous care plan where they can see the same person every time they come.
So this is like concierge medicine for the working poor, which is a phenomenal benefit.
Yeah.
And for you to combine holistic medicine with Western medicine, man, everybody wins, right?
Yeah, everybody. We're constantly looking at ways to treat the whole person, right? And so it's not just medicine, but it's nutrition. We just signed a great partnership with the UGA Extension Office, in Gwinnett. And they're going to be doing some diabetes education for us free of charge for our patients, available in Spanish, because that's the type of behavior we want to change. We want to transform the entire person. That's our tagline. So we are very excited about that, because to be able to offer that to our patients is just one more thing that they don't have to pay for, but can help them get healthy.
Now, I think I read that you're not emergency care. So you're open Monday through Friday. It's not after hours. Is that right?
Yeah. So even though we are not urgent care or emergency care, we do want to make sure we're providing adequate access. So when we say access to care, we mean Thursday nights are a late night for us, by late 7 p.m. So if you talk about the working poor, some of them work hours where they can't get a day off, right? Or they can't afford to take time off during the day. So they might need a 6 p.m. appointment. So we are always going to have a late day at one of our clinics so that we can accommodate that person. We also are open one Saturday a month for those folks who it's just not going to happen during the week. We offer that. So access is important, and being able to respond to the needs of the community, I think, is what we want to do.
You touched on earlier that you have medical, but you also have dental. You mentioned dental.
Yes.
And there's some other things. Let's talk about that. And how, because I would think that I've known people in my life that have never even been to a dentist. I mean, I come from a small town and working poor is prevalent there. Let's talk about that.
So dental is a very big part of our business, probably one of the fastest growing areas in our business because of the lack of access. And many of our patients, I would probably say about 30% of our patients have never been to a dentist before when they show up. And the thing is, a lot of nonprofits are getting out of the dental business because it's a very tough business to be in. It's expensive. Dentists are expensive. Equipment is expensive. Finding the skilled labor is hard. So we have 12 chairs total in both clinics. We employ all members of our staff are employed. And we have 2 hygienists. We have about 8 dental assistants. So total, we have about 15 people on our dental team to see patients. And it is a very valuable resource to the community because a lot of people do not have dental insurance.
I would think a lot of people wouldn't go to the dentist until you have a pain.
Yeah.
I have a toothache. I have something. It's not, like you said, preventative.
It's not something that you can fix at home, right?
Yeah.
So that's one of those areas where I think we've been successful in our dental practice, because when you're dealing with low income or working poor, if it's something medical, they might try to fix it at home, or they might take an over the counter. There's not much you can do for a toothache.
Yes.
And so to have that access to where we can work with someone who doesn't have the money for a general dentist visit it's been a real blessing, I think, to a lot of people. And some people have medical but don't have dental. And a lot of our dental patients have no idea that we have a full medical practice. They just come for the dental piece. Wow. And if you look at our dental facilities, and DePriest, you know this, if you've been to our clinics, we pride ourselves on how our clinics look physically. You do not feel like you're in
not at all
a nonprofit practice. It's nicer than my doctor's office.
It is very nice.
And we say we like to provide a dignified experience for our patients. We want them to know that God loves them, we love them, and that they are not less than, and they're going to be cared for. And that also helps when you talk about paying. Even though it's a lower amount, it's a lot of money to them. It makes the whole experience, they see the value in it.
We also offer prescriptions.
We do. What we offer is a dispensary. Our dispensary has changed a little bit over the past 6 months. What we do now is we generally help folks with what we call the prescription assistance program. And what that means is they come in if there's a high cost medication. A lot of people don't know manufacturers have to give away a certain percentage of their meds as a form of being able to dispense medication.
Wow, I didn't know that.
Yeah. So if you make a certain amount of money and you need certain insulins or certain inhalers, we may be able to figure out how to get that for you, sometimes free. Certain weight loss medications we can get for free for our patients. So it's worth it to really talk to your provider and see, hey, is this something we can get this patient for free? Can we get them some samples to help get them started? So that's all part of what we do in our dispensary.
That is incredible. But as you mentioned, you were talking about dental and medical. There's always some, like you said, home remedies. But if you need a prescription, they're expensive.
Yeah. And especially if these are life-saving medications that we're talking about, certain type of asthma inhalers, certain sorts of insulins, and they can run in thousands of dollars. And it really is amazing how we are able to get them for literally pennies on the dollar for the patient. But there's a lot of paperwork to do. And if you don't know about it, if you don't know what paperwork to turn in, if you don't know how to reach the pharmaceutical company, you need some assistance, and we will help walk you through that process.
What you're doing is tremendous to the community. How do you fund something like this? You have to have doctors on staff and dentists.
Yeah.
I think that they would require a high salary.
Yes.
And if you're asking for so little, how does that work?
So if you look at our funding strategy, our business is funded what we like to call 65-35, right? So actually patient fees, because of the size of our organization, we are able to fund 65% of our own self-sustaining costs, right? And then the other 35% comes from the support of our community, whether it be donors, whether it be grants, foundations, people who support us from afar, I like to call that. So yes, about 35% of our funding comes from other foundations and donors and such.
So shameless plug here. So Shameka and her team partner with the Community Foundation for Northeast Georgia, and Maria and I opened an agency fund through the Community Foundation to support a large expansion project that is a workforce development by nature, right?
Yes.
Tell us about that, because that was really exciting how we were able to evangelize that project, and I understand it was very successful.
Yeah. So actually, it's two projects, actually. So we work with you guys on year-end campaign, and also we are working through trying to expand Access Academy. Is that one you're talking about? Access Academy. So Access Academy is our next venture, and it is the training academy that we have decided to open because we feel like there is a gap in the amount of healthcare workforce development that we're seeing in Gwinnett versus the actual need. And so Good Sam, a lot of people, again, that don't know this about our organization, we've been training for 10 years now. So we serve as a training partner for PCOM, for University of North Georgia, Mercer, UGA. We train master's level students who come in for their family practice rotations. And so we decided, how can we work with maybe kids who are not college bound, kids that really look like and reflect our patient base. Really, realistically, couple of the staff that we hired were patient referrals. Oh, my daughter wants to work there. My son wants to learn more about medicine. So we started expanding our funding to include Access Academy because this is a venture that I think will propel us into the next phase of Good Sam. And it's going to allow us to continue to serve our community, to help those who want to enter healthcare and fill a tremendous gap that we're seeing in terms of staffing.
That's amazing.
So we're really looking forward to our continued partnership with Community Foundation and just making sure the community knows that is an option. If that's a passion point for them, workforce development, then that's something that we would like to let the public know that we are heavily interested in investing our time in.
So one of the advantages of being a nonprofit with an agency fund with our community foundation is we love to partner and we love to co-market great projects like what you're doing.
Mm-hmm.
And for nonprofits who want to get access to some new friends and some new donors, this is a perfect way of having your money work for you. For our family fund holders, a lot of times they'll open up a donor advised fund and they really don't know where they want to give money.
Right.
But they might have a healthcare passion to
Right.
support. And so we know organizations that are doing really great things. So Good Sam is one of 100 nonprofits that we actually hold agency funds for. And when we have these opportunities, we love to bring them your way.
Yeah, that's absolutely the reason why we wanted to partner with you guys, with the Community Foundation, because we know that collectively we're stronger, right? And bringing a group of like-minded people together who want to give back,
Mm-hmm.
I think it's very helpful because there are so many places out there where a donor can give and they might not know, they might be confused about what the options are. So it's it definitely is going to be very good partnership for us because I do believe that getting that word out there about the new initiatives that we're doing is going to be very helpful.
But we did something unique for Shameka and Good Sam because we created a QR code. It was more of a campaign.
It was more of a campaign, and it speaks to the work that we're doing in meeting nonprofits where they are.
Mm-hmm.
And I really love the fact that as part of that marketing, you actually did a virtual tour. We did a Zoom virtual tour, and Shameka just did a showroom of everything that they have going on. And then she did a virtual tour of the facility, and it was attended very well.
Yeah, it was a great way for folks who might not have had the bandwidth to step away and do a formal tour. The virtual audience, we're really looking at that overall with Community Foundation and just with being in touch with the community as a way to maybe pique interest.
Mm-hmm.
You know what I'm saying? Okay, I don't know about this place, but let me attend a virtual event or let me watch this Zoom. And at the end of that Zoom, we told people, if you'd like an in-person tour, give us a call. We could do something personal for you. So it's a great way to reach a wider audience
Mm-hmm.
and then really hone in on those who are truly interested in learning more about the partnership.
Yeah, we designed a QR code as well that linked to your fund.
Yeah.
So that it made giving very easy.
Yeah, absolutely.
So for those of us out there who would like to learn more about opening a fund and how you can support your organization or support Good Sam even, this is a powerful way of doing it. And we'll make sure that a link to your fund on this podcast will be provided on the screen for those who are supporters of Good Sam.
That's
yeah,
right.
and we've been co-branding, pretty much all of our marketing campaign and donation campaigns with Community Foundation. And again, a shameless plug, we have our spring campaign coming up.
Wonderful.
So that starts on April 16th. So we will be, again, co-branding and marketing that as a way for folks who want to give back. And the primary recipient of those funds that we raise are going to be our dental department.
Wonderful.
So spring is about dental. So that's coming out soon.
That's incredible. You were talking about virtual, and I was thinking, do you offer telehealth?
We do. We offer telehealth. So if a patient is in what we call the low risk range and the provider feels as though a simple visit, whether it's just a lab follow-up or, hey, a check-in, we will offer a telemed visit for $40. And again, that is up to the patient. We like to make sure that the provider is given permission for the patient to do that, but we do offer telehealth.
So those that are listening and they're outside of our Atlanta region, the telehealth is an option. Or if you want the QR code, how would someone find your QR code? Someone wants to get involved, your spring campaign, whether it be telehealth or at a distance.
Yeah, we have a very robust website, goodsamgwinnett.org, which gives a lot of information. If you go to our donate page, it's going to list all the options that you have to get involved, whether that's giving through Community Foundation, giving through our own personal website, mailing us money, or working through your stockbroker or any type of investments that you might have. That is all located on goodsamgwinnett.org/donate. And then we also have have many of on our website, our blog posts. We're all on social media. We're on LinkedIn, Facebook, Instagram. Our marketing manager does a fantastic job of keeping everything updated and creating content to let our supporters know what we're doing.
It's great because it really is a full community-wide initiative. I mean, for us to everyone to pull their weight and create synergy. You mentioned stock.
Yes.
That's another area that, we come alongside as a community foundation. And if someone's wanting to donate stock or something of high value, such as land, vehicles, jewelry, anything that we can help liquidate to be able to give that back to the Good Sam. That's what we do. Or not just the Good Sam. We do it for lots of different organizations, but specifically for this call. If you're listening and you have something else you might want to contribute for this spring campaign.
Yeah.
It's going live April 16th.
April 16th.
Yeah.
Yes. Yeah. And that's again, one of the reasons why we partner with Community Foundation, because we wanted to be able to give more options to our donors. And there's only so much as an entity that we can do on our own. So we definitely wanted to partner so we could give someone who may say, hey, I don't want to liquidate cash right now, but here's a possession that I have that I want to donate, estate plan, that type of thing. So we definitely wanted to give our donors more areas to choose to how they want to support us.
It's incredible.
I want to pivot back to Sam and the Christian walk, the faith walk, because when I toured, I was very touched by the fact that every day the staff gathers together and start the day in prayer.
Yes. I just did one this morning. We start our day with devotion. So every day for the first 15 minutes, we meet in prayer and we talk scripture, but we also talk about testimonies. Staff are encouraged to give a testimony if they have one, and they are asked to talk about their faith. We openly encourage that. So yes, that is a big part of who we are and what we do. We are able to pray with our patients if they ask, especially if they receive a diagnosis that is hard to hear. So we are able to give them that comfort. Some of our patients come in and they don't want that, and we don't offer it for those that are not interested. But for those that are, we are encouraged to do, because that we are faith-based, unapologetically faith-based, and it's part of who we are and what we do for our patients.
And I know that for a lot of your families, they're being affected by immigration and the changes in immigration. How is that affecting your patient base?
So what we're seeing from our patients is there is a fear, and I speak, this is legitimately what we've heard from patients. Patients have been canceling appointments because they're afraid to come, right? Or afraid to be outside of their house, or afraid to risk being on the highway. And so, it does affect their care in terms of follow-up visits if they need additional medication, if they need to come in for lab work. So we have seen an effect, and we have received feedback. I think it's just going to be one of those things that, probably for the next couple months or however long it's going to be prevalent, but we have seen it talked about in our clinic.
The other area that I read about, and by the way, not minimizing what you just said, because right now we're hearing a lot about this, and I'm really grateful to you to step up and help everyone. The other area that I read about is long COVID.
Yes.
Because COVID was a thing. I didn't believe that. I can tell you firsthand, because I have long COVID.
Okay.
And so I want to hear more about that for those that to understand what that is and what you do about that.
So that idea, that concept of including treatment for long COVID came about right after we came out of the pandemic. We had folks who were experiencing lingering symptoms, right? Long after their COVID had left, there was a lot of brain fog. There were things that they couldn't quite put their finger on. And so we actually had a former board member who was a pulmonologist, because our providers and our medical director, we were getting patients who were coming in and they really couldn't explain what was happening. And for uninsured patients, they can't afford to go from doctor to doctor. And this board member introduced us to a current pulmonologist at Emory who explained to us what long COVID was. And he said, and let me tell you, it is something that you can treat at the primary care level if you have a protocol for it. And so he wrote us a protocol for it to help. He said, because I can tell you some things can be treated here, some medications that patients can take here, some referrals that you can do in terms of what they should be taking, how to deal with certain issues. And so we put that on our website to let those who may not be insured know, A, that we believe you, that it's a real thing, and B, we can save you some money financially if you can't afford to go to a pulmonologist versus maybe a psychiatrist if you're having brain fog and you don't really know what's causing it, maybe an allergist if there are some things happening. So we were able to create our own protocol for that. And fortunately, we have some very good partners, some physician partners who are willing to walk alongside us as we continue to develop that protocol. But yes, we will see patients for that.
But that's good to know. For those that are listening, we may not even know. I say we because I know, but with this brain fog or why am I so tired?
Right.
Not realizing that, oh, wow, this is the impact after that and that I know where I can go.
Right. Absolutely.
And be seen because I wouldn't know where to go.
Right.
You didn't know what it was.
Right.
Diagnosed.
That's amazing.
Yeah. And to have someone who was seeing very sick, he was working in the Emory ICU at the time when COVID was really rampant. And he said, some of this you can treat at primary care, and I'm happy to support you. I'm happy to help you offer this service for folks who may not be able to get the help elsewhere. So we've been very blessed to have people who have just looked at our mission and said, I want to help.
That's a huge blessing.
Yes.
I love that you're so innovative. And thinking out of the box, and definitely is fee-based, but you're meeting people where they are. Is what we do with the Community Foundation. You mentioned about how we work with all our nonprofits. I think that's what we need to do this day and age, is not everyone's in the same bucket. And it sounds like you're unique and you have the staff that will actually ask the questions to find out where are they? What do they need? And it sounds like you're always plugging something in as a leader and where the need needs to be met.
You brought a high touch of relationship to healthcare.
Yeah.
Yes.
And you have made that very prevalent in how you provide service. And I just want to thank you for sharing with us. Are there any immediate needs or things you would like to tell our listening audience around? We got the campaign going, but is there anything that you specifically need to tell them that how they could support you?
Sure. I will say, in addition to the kickoff for the spring campaign on April 16th, we are having a ribbon cutting at our East location at Jimmy Carter and Rockbridge Road, and that's April 16th at 10 o'clock. Okay. And we are showcasing an addition that we recently had constructed for what we call the Screening Prevention Annex. And this is going to allow us to do vaccinations at that location, childhood vaccinations, which we were not able to do before. And it's also going to allow us to provide better care for infectious disease because we now have a sick waiting room versus a well waiting room. And this was a 2-year project that we just completed, and it's beautiful, and we want the community to come see it. So we are advertising that ribbon cutting event on April 16th. And then after that will be the official launch of the spring campaign. And so if dental is a passion point for you, please take a look at that. We're going to have some dental needs on our website that you can assist with. But throughout the year, whether it's through the Community Foundation or through us, if healthcare is something that you're passionate about and access to healthcare is something that you're passionate about, we would appreciate your support. And we love to give tours. Awesome. So if you want to come see our facility in person, please reach out for a tour.
How would they find you?
So goodsamgwinnett.org is our website, and also contact us at goodsamgwinnett.org is a generic email address that comes directly to our leadership team. So we have a lot of people contact us that way, literally, and it goes right to someone in leadership and we will respond.
And if you didn't get all that, you can always reach me at mwalden@cfneg, and I will forward all that information over to Shameka. This has been an amazing learning experience for me. Wow, kudos. And this amazing things you're doing in the community.
And they could also go to our website, cfneg.org, and they could go directly to Good Sam's portal if you want to make a donation directly into their fund.
That's right.
Absolutely.
And like I said earlier, it could be money, it could be stock, it could be a lot of things. Yeah. So let us know. We are so grateful that you made the time to come and visit with us today and learn more about what you're doing in the community. And it's such a need. Anything to wrap up, DePriest? Any thoughts?
Just thank you again, Shameka, for all the great work you and your team are doing, and just keep it up.
Thank you so much.
Yeah,
it's great being here.
Thank you so much. Hope to see you soon.
Thank you for joining us on the Good to Give podcast. This show is underwritten by the Community Foundation for Northeast Georgia, working with donors and nonprofits, improving our world through the power of philanthropy. For more information, go to cfneg.org.